So today I'm going to share with you my experience treating acne using physical modalities, mainly the long pulse Nd:YAG laser, but I'm also going to touch upon using PDT. So just a quick reminder about the pathogenesis of acne. Under the influence of multiple factors, including hormones, genetics, diet, and external factors, we have a number of processes involved in the pathogenesis of acne. We get increased follicular desquamation, increased sebum production, formation of comedones, and then colonization with the bacteria, the P and the C acnes, which leads to subsequent inflammation and forming of pustules and papules, and eventually rupture of the follicle wall, leading to further inflammation and formation of abscesses. So how do we try to treat acne? We try to control these processes by decreasing follicular keratinization, decreasing sebum production, reducing bacteria, and reducing inflammation. How do we achieve that? Well, there are a number of treatments that we can use, as you all know, ranging from topical treatments, mainly for mild to moderate acne, to oral medications, antibiotics, isotretinoin, anti-androgens. However, a lot of these medications carry some risk of side effects. And lastly, we have the physical modalities, which are on the rise, are being increasingly used to treat acne. And this could be anything from peels, lasers, or PDT. And today, I'm going to focus mainly on lasers. So the laser there are multiple wavelengths that have been described in the literature and used to treat acne. I'm going to focus mainly on the long pulsed Nd:YAG, which is what we use in our clinic, and I have the most experience with in treating acne. So in terms of my experience over the last year, I treated about 22 patients with this laser, 10 males, 12 females, age ranging from 14 to 37. All the patients I treated had moderate, with a couple verging on severe acne, and skin types ranging from 1 to 5. The treatment consisted of optimizing their skin care, which is very important, using cleansers morning and evening, avoiding or using oil-free products, whether it being a moisturizer or sunblock, and sometimes we added in a retinol at night. Regular cleaning of comedones was also performed in the clinic, and we did 2 to 3 weekly sessions of the long pulse Nd:YAG photoner laser. An average of 4 to 6 sessions for every patient. 20 out of the 22 patients, about 91%, achieved more than 90% clearance with this regime, and there has been no recurrences so far, with the longest follow-up about 9 months. What's the potential mechanism of action of the long pulse Nd:YAG laser in this case? The Nd:YAG laser likely reduces inflammation by its impact on blood vessels. It also reduces sebum production and P and C acnes through its action on causing heat damage to the sebaceous glands. There aren't many articles in the literature about using this particular laser for treating acne. In fact, there aren't many articles about using lasers in general to treat acne, but there are a few studies ranging from case reports to a couple of double-blind randomized controlled studies, and they all show the same thing. They show an improvement ranging from 70% to the high 90s, consistently across the whole literature. So I'm just going to share with you some of the cases that I've treated. This is a 30-year-old Caucasian lady. She didn't have any PCOS or hormonal issues, and she presented to me with this acne picture. I treated her using the long pulse Nd:YAG laser. Because she has fair skin, I used slightly more liberal settings, higher settings. And this is her after 5 sessions at 3 weekly interval. You can see almost complete clearance of her skin. This lady, 9 months down the line now, there has been no recurrence. This is another patient, a 14-year-old with moderate mixed acne and skin type 4. Because he has a darker skin type, I use slightly more conservative settings with the laser. And after 5 sessions, again, you can see excellent clearance. And 9 months down the line, there has been no recurrence. This is the third case I'm presenting to you today. This is an Asian patient, skin type 5. And again, I use slightly more conservative settings because of his skin type. And after 6 sessions, again, near complete clearance of his acne. And this is a frontal view. Now, I must say that I find the Nd:YAG, long pulse Nd:YAG laser to be extremely safe, and I'm getting more and more confident with the settings. When I started, I was a bit more conservative. As long as patients are sensible and follow sun protection and aftercare advice, I haven't had a single side effect from the treatment. Now, in terms of PDT for acne, before actually moving to PDT, the 2 patients that didn't respond as well, one of them actually responded very well, and she had moderate to severe acne. However, she was using some products on her own at home, and she experienced flare-up. And we're trying again to gain control, but we had to add in an antibiotic. And another patient, due to personal circumstances, she couldn't continue with the treatment of laser, so we switched her to Roaccutane. PDT for acne, most of the PDT used for acne is 5-aminolevulinic acid PDT. There is more evidence-based actually in the literature regarding PDT compared to acne, and it's been listed in the latest British and other European guidelines as a good option for treatment with good evidence. It can be used for severe acne. It's probably more effective for severe acne than laser. Usually the PDT is activated using different sources of light. Could be a blue light or a pulsed dye laser or even daylight PDT. However, there are no standardized protocols as yet on how long to incubate the PDT, exposure to light, frequency of sessions, etc. I just want to talk about our experience in the clinic. This is a case treated by Dr. Tuma. We reserve PDT for the more severe cases. You can see this case is nodular cystic. We use ALA PDT, incubated for 1 hour, and then we activate it using blue light for 15 minutes. And usually we do 1 or 2 sessions 1 month apart. In this case, this is the improvement after 1 session in this patient, which is really good, very impressive. It's almost like using Roaccutane for a couple of months. So in summary, there is a growing evidence to support the use of physical modalities for the treatment of acne, and I think this is important. A lot of patients coming nowadays, they don't want to take medications, they want to avoid the side effects, and we should be able to keep up with that and give them better options. There is a need, however, to standardize the protocols for treatment of acne using physical modalities, whether it being lasers or PDT. And I think it's very, very important if someone is going to use these modalities to have experience in all types of treating acne, including medical treatment, as patients have to be managed differently sometimes and change from one treatment to another. Thank you all for listening.